Hello, everyone. My name is Dr. Richard Horowitz, and I am the co-host for the Healing from Lyme Summit. It's my great pleasure today to introduce to you Dr. Nafysa Parpia. She is a board-certified naturopathic doctor and director of naturopathic medicine at Gordon Medical. Throughout her career in holistic medicine, which has gone on for at least 12 years, she's focused on treating patients with complex chronic illnesses and specializes in tick-borne diseases such as Lyme disease, environmentally acquired illness, mold and mycotoxin illness, autoimmunity, fibromyalgia, long-haul COVID, and ME/CFS. She uses cutting-edge laboratory tests and deep intuition, and I want to talk to you about that because I do the same, and I don't think we talk about it too much, applied to the full range of scientific data to create comprehensive treatment plans that are highly personalized. Dr. Parpia's targeted system of care includes a synergistic blend of regenerative medicine, oral and IV micronutrient therapies, peptide therapies, botanical medicine, pharmaceuticals, injection therapies, and functional medicine. And she's on the board of the ISI Board of Directors, the International Society for Environmental Acquired Illness. It's nice to have you today.
Thank you so much. What an honor it is to be interviewed by you.
Oh, sure. It's my pleasure. We had met actually at the ILADS conference, right, with Eric. That's the first time I think we'd met each other.
Yes. Yeah.
So tell me, as a naturopath, you had a lot of directions you could have gone in when you got out of school. How did you get into Lyme and tick-borne disease? How did this whole thing unfold for you? Tell people a little bit about how this happened.
Sure. So we were trained to be great general naturopathic physicians at Bastyr. And when I was being trained as a naturopathic doctor, I knew that I needed to do more. I wanted to work on people in their healing journeys, and being trained in general naturopathic medicine wasn't really going to take me there. I knew there was just so much more that I wanted to do. And so I had the luck after I graduated to shadow and work at Dr. Dietrich Klinghart's clinic in his IV room, but I also was mentored by his top doctors there and by him for a year. And I learned a lot about detoxification therapies. I learned a lot about complex chronic illness there. And I remember sitting there, I was with him sitting on a table, watching him with the patient, and I was covered in goosebumps. And I just knew, this is my patient population. This is who I'm going to work with. So then I got invited to work at Dr. Isaac Elias's clinic soon after that. And he hired me to work with his Lyme patients, to head up that department of his clinic, the Lyme and mold section of his clinic. And he taught me a lot about detoxification therapies. So then I put together what I learned from both of them and really made it my own. And that's how I got into this. And of course, all the ILADS trading, how could I not, right? And merge that with everything.
So as far as the question was, for example, with chronic Lyme disease, you defined it a little bit differently. You don't think, for example, it's the correct name. And I agree with you because there's so many overlapping factors. Tell me a little bit about how you define Lyme disease. Like, can you expand on what you think the correct name actually should be?
Right. Great. Thank you. So I'm talking about a certain patient population, right? So there are some patients, they see they see a Lyme literate doctor, they do the ILADS protocols, and they have a wonderful recovery. There are some people, you take them out of a moldy environment, give them a little bit of support, and they do well, they make a recovery. Now, I'm talking about the patients who they've been to infectious disease, that didn't work. They've even seen a Lyme literate doctor, they've done the Lyme protocols, they should have worked, but they didn't work. It either made them feel worse or it made them feel better for a short period of time, but then made them feel worse. Or they've got a Sears diagnosis. They've done the Shoemaker protocol. It did nothing for them. I see that. Or people who do have mast cell activation syndrome, but it's the only diagnosis that they've been given. It's the only treatment they've been given. And they're on all the right medications, they're on all the right herbs, but nothing happens. So by the time they've got to our clinic, and of course, by the time they've got to you, there's so much else that's been going on. They've got multiple root causes that has created inflammation that's perpetual. Now, at this point, that inflammation meets the genes, and the genes express. And now they have the same end diagnosis, but there are multiple root causes that have then created different biochemical effects in the body. So I tell my patients there's 5 reasons you get sick. Infections, toxins, structure integrity issues, diet, lifestyle. And so, a lot of doctors are only just looking for Lyme, but we're looking at multiple chronic infections in multiple different systems of the body. So usually these patients have infections in the genitourinary system, in the gut, some of them in the lungs, in the sinuses, in the mouth, the nervous system, the connective tissue. So they've got infections in all of these different systems and of different types. It's not just tick-borne diseases. There's, of course, the tick-borne diseases, parasites, funguses, different bacterial infections, viruses, all of these. The environmental toxins, I'm seeing a lot of glyphosate, microplastics, I'm seeing a lot of heavy metals, all kinds of environmental toxins. Structure integrity issues, I'm seeing people who have tight tissues and there's not enough circulation, not enough lymphatic flow, or people who have lax ligaments. I know you see so much of this too, right? And so with the lax ligaments, most of these people do have mast cell activation syndrome, but those mast cell chemicals that are being released constantly are tenderizing those already lax ligaments. So if the ligament here holding up the brainstem is already lax and now it's more lax from the mast cells, well, then there's pressure on the brainstem and we get cranial cervical instability. Or lifestyle, I'm talking about trauma, adverse childhood events, sleep issues. These patients have all of this going on. Diet, usually by the time they've come to us, they've got that dialed in, but over their lives, they've had standard American diet wrapped in plastic, non-living foods. And so each one of these chronically on its own is going to cause a lot of immune dysregulation. But you put all of these together chronically over time, we've got a highly dysregulated immune system and a lot of inflammation that then meets the genes.
Right. And by the way, so what you're describing is exactly what we see in our clinic. The way I usually describe it is I describe it as 6 rivers of inflammation leading to 10 downstream. And I know you and I have come from this perspective. It's the same thing. So for me, the infections is generally I call them the 3 Bs: Borrelia, Babesia, Bartonella. And in a second, I want to get into how many of these you're actually seeing. Definitely environmental toxins with mold, heavy metals. I mean, everybody at this point, what I just read was people are getting a credit card worth of plastic every week, but between the micro and nanoplastics getting in. We're seeing microbiome issues. We're seeing leaky gut and food allergies, which contributes, of course, to the inflammatory. And then the downstream with POTS dysautonomia and autoimmunity and pain syndromes and hormonal dysregulation, right?
Yes.
All of these different things. So yes, we are seeing absolutely overlapping. Now, in your clinic, are you seeing a lot of overlapping Babesia Bartonella like I am in our patients?
Yes, absolutely. I absolutely am.
Great. And are you finding the protocols work? Because the problem I've had is, I started using Mepron and Zithromax 20-something years ago. It was definitely 5 years ago. But now the bugs are becoming resistant. So I'm forced to rotate anti-malarials. Do you have any tricks you guys have developed? Because I'm using, cryptolepis and Japanese knotweed and Chinese skullcap, mixed with acornia and all these different herbs with Malarone or Mepron and tafenoquine, mefloquine. I'm rotating. What are you guys doing?
We're doing many things, but peptide therapies have made a major impact in the way that we treat. So we're doing a lot of peptides and a lot of detoxification protocols. So just really looking at their labs, looking at their heavy metals, looking at their environmental toxins, at their mycotoxins. I'm actually modulating their immune system first, usually with peptides, and that's what I found has been a game changer in the way that we treat, actually. Now, there's something else, though, that I wanted to bring up about it being a more personalized illness, because this ties in to the way that at our clinic we're thinking about these things. So Dr. Robert Navio, I know you know who he is, but for our patients, he's the researcher behind the cell danger response, and he's a dear friend of Dr. Gordon's and myself, and we meet with him often. We met with him recently, and he told us something that just was so eye-opening, and it confirmed what I've been thinking all these years, and I know you're gonna love this as well. So he was saying that in almost all of these acquired complex chronic conditions, he said, including Lyme, fibromyalgia, ME/CFS, from his research, he's seen that there's no one gene responsible for the same diagnosis in different people. And he's seen that it's hundreds of different genes and hundreds of different biochemicals acting in a coordinated manner. And it's different for each individual, right? But the medical establishment likes to think that it's the same, right? One diagnosis, one system affected, probably similar genes, right? And similar biochemistry going on. But Dr. Navio saw when he measured abnormal biochemicals in people with the same diagnosis is that they had 25% of the same abnormal chemicals, or sorry, that 25% of the abnormal chemicals were the same in people with the same diagnosis, and 75% of the abnormal chemicals were unique to each individual. So the way we're going about it is really looking at the uniqueness of each patient. And we actually had the Metabolone lab representative talk to us today. So I'm really excited to dive more into the metabolomics and look at the different biochemical unique properties of each patient. You know, we're already doing that by looking as much as we can with various labs, but I think that this is going to allow us to see even more. So I'm excited about that.
Have you found with that approach, though, I mean, just getting back to the bugs like Babesia bartonella, because they are difficult to treat, using that type of an approach with the genetic approach, metabolomics, you found that you were able to like tweak biochemical mechanisms to make the drugs more effective? I just want to see, like, because right now, I mean, Babesia has become resistant. The recent study was tafenoquine and atovaquone, right, is supposed to be the most effective regimen for resistant Babesia. We have tried it. It does not work for most people. It may help. We sometimes have to use other things with it, lots of herbs or other anti-malarials. So we're having a devil of a time. I mean, double dose or quadapsone helps lower it. Sometimes they get lucky. But when I've spoken to Bob Navio about the cell danger response, and he was talking about how it gets stuck with extracellular ATP needing to increase it, the problem is you got to get rid of course, the infections, get them in a safe environment, right? If they're not in a safe environment, right, the mitochondria are going to stay stuck. But are you finding that you can tweak the biochemical pathways a bit with what you're getting to make the drugs or the therapeutics more effective?
Yes, I'll tell you about this. So I wish I could test those metabolomics. I can't yet. I'm hoping that the metabolome lab will allow me to do that. So this is where I do have to go with what I'm seeing happening with the patient, right? So the peptide therapies and heavy detoxification therapy helps so much. What I think, I could be wrong, right? And I'd love your insight on it too, but I think that it's about the environmental toxin load that's creating further immune dysregulation. Right? Before we could live side by side, but there are more people who could live side by side with these bugs. And before the treatments we know work, they worked, and now not so much anymore. So I find that as I'm modulating the immune system with the peptides first and using a lot of detoxification therapies, then I can come in and treat the bugs, and it's a lot easier. And in fact, I use a lot more herbs. Dr. Gordon uses more antibiotics. Dr. Harris uses more antibiotics, and I'll use antibiotics too. But you know, I use herbs and peptides more, and for me, that works.
And
Yeah.
it's allowed. You're allowed to do this in California. It's not an issue.
Yeah.
Okay. And for Bartonella is also showing up very frequently in our patients. Any particular herbs or treatments you found that are working for them? Because the last study we published, we're finding these pulses of high-dose dapsone with rifampin, zithromax, methylene blue is definitely helping a large percentage of these resistant patients. And I spoke to Eric, I know that, and I'm going to help you guys actually to use the protocol and to teach it to him so he can use it in the clinic. But any other tricks you're finding for Bart in these patients, or it's the same? It's kind of like, you've got to get the immune system dysregulation. You've got to deal with the toxins. Like you're finding, like in your patient population, those things are essential first before you're going after treating the infections. Is that what I'm hearing correctly?
Right, absolutely. And then I can go after treating the infection. I layer those things on at the same time. I keep the immune system, the immune system regulation treatment concurrent anytime I'm treating any infection, because I know there's going to be a cascade of inflammation that comes when I treat, say, BART or whatever infection I'm treating, right? So I'm modulating that immune response as I'm treating, and I'm doing detoxification as I'm treating, and it makes everything so much easier. So if I can treat a lot of infections at the same time using TA1 and LL37 peptides. So TA1 is going to kick up that immune response. LL37 is cytotoxic to a host of different microbes, including tick-borne infections. So I'm using those peptides when it's time to kill the infections. I'm using the herbs that might be particular for Bartonella. I'm detoxing them. It could be with IV therapies at the same time. I'm also using a lot of intravenous therapies to treat the infections as well.
Mhm.
So
And
yeah.
what IV therapy specifically you're finding the most
So
important?
yeah, so there's the oxidative therapies. High dose vitamin C is one of those. And then I like to use the PK protocol for detoxification therapies. I'm giving people amino acids and minerals as cofactors for the detox system, because a lot of the times they're not ready for even detoxification, because as we detox people, that creates inflammation. But these patients are stuck in perpetual inflammation. And so sometimes they're not ready for detox. I look at their cofactors for detox, and I see, are you ready for it? I look, is your glutathione in oxidative stress? Well, I can't give you glutathione to detoxify you yet. So a lot of times we're starting with the cofactors intravenous. I need to bypass the gut because their gut is already a mess. And I'm working on treating what's going on in the gut at the same time. So cofactors, the natural detoxification therapies, which could include glutathione and phosphatidylcholine when they're ready for it, and then coming in with the oxidative therapies and layering it all. So doing different IVs on different days, sometimes working on treating the infections, sometimes more on detox. And we're watching the patients like a hawk to see how they're responding to those. Some people, of course, they get the IV antibiotics, right? That can be very important for a lot of patients, but always balancing it with detox.
Got it. So the cases that we are seeing, I'm now starting to see also COVID starting to bring out some of these infections. Are you also seeing some of the long COVID overlaps kind of interfering where the viruses are now reactivating? Because we're starting to see some Epstein-Barr reactivation, herpes virus 6 reactivation after people get COVID, where they were even doing well, with the Lyme and tick-borne for a while. Their POTS is under control, and all of a sudden they get COVID. And it's like, oh, they're now reactivating viruses and old things are coming up. Are you seeing that in some of your population too?
All the time. So we treat a lot of long COVID patients. So I bet this happened with you too, right? The patients who had been your patients for a while prior to the pandemic, during the pandemic, they did fine. They didn't get long COVID, right? Then they go away. They're not in treatment anymore. And boom, that inflammatory cytokine flare woke up those dormant infections. And we're getting a lot of patients come to our clinic who are suddenly sick. Actually, suddenly they have Lyme, or suddenly they have the herpes family of viruses active, all of them all at once. And we know it has to do with spike protein. And we're testing. We really like Dr. Jordan Vaughn's microclot test to understand, are microclots an issue, right? Or there's also the long COVID panel. We can look at that. So I like to marry those tests with looking at the possibility of the other infections being active, for sure.
Great. And with the viruses, are you finding any particular herbal protocols or natural protocols? Because I mean, this is only a certain amount that we have in medicine, whether it's famciclovir, acyclovir, valcyclovir. I mean, there's a bunch of gamcyclovir. There's a bunch of them, or even using ivermectin for its antiviral effects. Do you like anything specifically in the herbal natural realm that you're finding is helping?
Absolutely true. I love Argentine silver. That's the only silver I'm going to use, because it's excuse me, because it doesn't bioaccumulate in the body, and I've been using it for a long time. I like that a lot. We can do it orally, if necessary. For some people, it can be done intravenously. It can be nebulized. I'm seeing a lot of infections in the sinuses, actually, more than I saw before. So I used to see a lot of mark-ons prior to the pandemic. Now, after this pandemic, I'm seeing a lot of Klebsiella. I'm seeing a lot of funguses in the sinuses. So different infections.
Mhm.
And I'm seeing all of this in conjunction with the tick-borne diseases. So I'm, my style is a little bit different, and I'm going after all kinds of other infections, and I might not get to the Bartonella right away because I'm modulating the immune system. I'm working on the gut because I know most of the immune system, this is a more naturopathic way, right? And then modulating the immune system, and most of that's created in the gut. So once I've done all those layers, I might add in Bartonella herbs, or I'm going to add in herbs for viruses. Going back to your question about viruses, I like Andrographis as well. And high dose vitamin C, right? And then we see a lot of recovery.
Mhm. Do you raise do you like the natural killer cell ones, like the transfer factors, 3,6 beta glucan? Do you like those also for raising because we've been testing the natural killer cell counts and function and finding they are low in some of these people, which obviously is a disaster if you're dealing with chronic viruses and of course puts you maybe at risk for cancers. But are you using those things also to modulate the natural killer cells?
I am, but I like TB4 peptide for that as well. So I'm using TB4 to calm it down, but TA1 is also going to modulate as well. So I'm using those two peptides a lot. With the advent of peptides, I'm finding that things are happening much faster. So
Mhm.
patients who, before I use peptides so much, who maybe would take 5 years to treat, they're now taking 2 years or 1 year. People who take 2 years, who would take 2 years, are now maybe 6 or 8 months. So those peptides, they've been just a godsend for my practice. I have to say that.
Great. So what other concurrent issues? I mean, we've been talking about that you're having to work on the gut, having to work on the detox, immune modulation before you sometimes get to these bugs. Any other concurrent issues you think are like the most important? Because the downstream effects of inflammation we've been seeing, we do see mitochondrial dysfunction in about a third where, mitochondrial regeneration helps. We see POTS dysautonomia in probably at least 40 to 50%, right? Where we've got to modulate the autonomic nervous system. But also we're seeing, of course, autoimmunity and people with hormonal disorders, men with low testosterone, people with low adrenal function, right? I mean, we're seeing all of this apart from neuropsych issues and the rest. You're seeing the same concurrent overlaps in your population?
Yes, absolutely. We speak the same language. I mean, yes, all of them. And so one of the main things I'm seeing at first, I'm keeping my eyes out for, right, is this immune dysregulation. So I'm talking about that. I'm talking about a hyperactive immune system and a weak immune system at the same time. So hyperactive meaning they've got well, my window just fell down. The screen just fell down. Excuse that. So hyperactive, meaning they've got autoimmune conditions, right? So for our patients listening, rheumatoid arthritis or Hashimoto's or scleroderma, things like that, lupus. So a lot of autoimmune conditions, and we're seeing mast cell activation syndrome. So that's the hyperactivity in the immune system. On the other hand, there's a dampened immune system. So we're seeing that they can't mount the appropriate immune response to kill off all those concurrent infections that they have, or their immune system is more permissive to infections that they are exposed to, or like we were talking about earlier, the infections that were once dormant, they're easier to wake up with an insult, say spike protein from
Mhm.
COVID. So this hyperactive immune system, this weak immune system concurrently. This is where I use peptide therapies first. I tell my patients, like having an untrained fighter in the ring. The fighter is throwing kicks and punches, but in the wrong direction and at the wrong person. So I'm using the peptides to just modulate that immune response first, right? And then I'm seeing, of course, the nervous system dysregulation, just like you were talking about, the POTS, which leads to, or sorry, the autonomic nervous system dysregulation, including POTS and issues like maybe slow motility, the stomach not emptying, too much sweating or not enough sweating, vagal nerve issues. But then we know it might not necessarily be the vagal nerve's fault all in it, right? It might be that the organ itself, say an irritated gut, is irritating the vagus nerve, which then irritates the other organs that it's innervating. So I'm working with the nervous system. A lot of people, we can't even come in through any other doors until we manage the nervous system. And of course, the GI issues, IBS, inflammatory bowel disease, we know it's usually a combination of the microbiome, leaky gut, nervous system dysregulation, structure integrity issues. Bartonella and Lyme love the gut.
Right.
And then pain, and then the connective tissue weakness. This is a big one. I'm sure you're seeing this as well. So we're seeing a lot of people who have lax ligaments. They've got cranial cervical instability, or I'm seeing uterine prolapse, or people losing their teeth when they should not be losing their teeth. They have great dental hygiene. It's about those lax connective tissues, which I've seen the peptide GHKCU help wonderfully. It's changed people's lives who have those lax connective tissues. And of course, the hormonal dysregulation that you talked about. I see my young male patients with testosterone of an 80-year-old man, or young women with major hormonal imbalances. So these are things that we see.
Right. So it sounds like you're seeing all 16 points on the MSIDS model that I've been describing. And by the way, regarding the immune deficiency, do you have to get your patients on subcutaneous immunoglobulins like Kyncentra, Cuvitru? Do you manage to get them on them in IVIG? Because we find that we're finding a lot of immune deficiency, also, of course, overstimulation with autoimmunity. But a lot of my patients have low IgG levels, low subclass levels. I mean, they won't fight the infections unless they get their immune system up. So are you concurrently using IVIG or subcutaneous in some of these patients?
We're going to start getting it more. So we use it when we can. We've been able to only order if we have a neurologist on board.
Oh, really?
But I think we'll be able to start using it more, which I think is just so important.
Yeah. California sounds like they may be a little stricter in that range. We have someone, he used to work with Diplomat, David. He used to come in all the time, and he would get us approval actually all the time for IVIG or sub-Q when we needed it. We have obviously sent him to neurologists, but we find we can pretty much do it ourselves a lot of times. But we have used, people who've helped us to get the approval through the insurance companies, because you have to go through a lot of hoops. And I think if you need the name of this person after we're done, I can give you the name of David's contact information. I think their company is probably nationwide. You may find if you're trying to submit through insurance, you may need somebody like him who might be able to be the front person, who might be able to get it for you.
Appreciate that. Thank you. Yeah.
Yeah.
That'd be great.
That's great. So look, I think so what you're describing with the Lyme of not being the correct name is you pretty much are. I mean, the word I've used is Lyme MSIDS because it reminds me that I've got, 6 overlapping factors of inflammation and 10 downstream effects, 16. It sounds like we're talking about the same thing. The most challenging, by the way, for me in all of this is the cell danger response when the mitochondria gets stuck. Because when I've, learned from Bob and spoken to him about that, getting people in safe environments with the climate the way it is, with the wildfires that, of course, you've been seeing and the mudslides and it's not the easiest in the world for people to find safe environments these days. And also Bob was talking about needing in some of these people to increase the extracellular ATP, like when he was using Suramin, right, in that population for autism, and their brains woke up and it's like, oh my God, why can't we get this drug, for the autistic population here? The closest I found to that drug from Hopkins studies was sulforaphane glucosinolate broccoli seed extract, which seems like it had maybe some modulatory effects in the same way in the autistic population. But I find that's the trickiest one when these people are sick, when we've already detoxed the mold, we're clearing up the infections, we're dealing with the POTS, we're getting them to sleep, we're healing their leaky gut, we've dealt with the immune deficiency, and they still are stuck. And a lot of times it might be cell danger. I find that's one of the most difficult ones, actually, with the chemically sensitive patients to get them through.
Right. I will agree with that. Absolutely. And have you noticed that if they're given mitochondrial support early on, it doesn't work or it backfires, right?
Correct.
Right. And it's because that the mitochondria they're not sick, they're not broken. They're just doing what they need to do in that moment to protect the rest of the system, right? Sending that ATP externally as a warning signal to the rest of cells. Hey, we've got some danger here. We've got to protect ourselves. And so if we throw in antioxidant support when the mitochondria are creating oxidative stress on purpose at that time, it's just not going to work. Or if we try to rev up the mitochondria and we're revving them up, but they're creating more ATP and it goes more external, the person's not going to get more energy. And so
Yeah.
usually saving mitochondrial repair work for after. I think of it as two sections. Like we're in the treatment phase, like everything we just talked about, right? Working on I work on the downstream effects first, then I bring in detoxification and maintain the downstream effects. Then I bring in working on the triggers, all of it at the same time. I think of that as treatment phase. The
Mhm.
next phase, I think of it as being in the repair shop. That's when using the peptides is actually going to start retraining the nervous system. At first, they're just great band-aids, right? And that it's
Yeah.
also in the repair shop section, it's when I start to work on treating the mitochondria, maybe using NAD or having them do red light therapy, things like that. Or
And we've developed the mitochondrial. The way I've done it now with the Dapsone protocol is I routinely give it after they're done with knocking down the biofilm persister load of the bugs. Because I mean, any drug you give these days, just living on the earth, there's a lot of free radical oxidative stress. So your mitochondria are having a problem no matter what we do, whether we treat infections or not. But I do find that it works better, as we were talking about, after the Dapsone therapy. And that's why I will routinely do a month of it afterwards. ATP 360, CoQ10, acetyl L-carnitine, NADH, MitoNR with nicotinamide riboside. I use MitoPrime from Zymogen. I'm starting to look at urolithin A. I haven't integrated as much yet, but I'm looking at it for some of the resistant patients. But yeah, definitely, I do think the mitochondrial support works much better after you've knocked down the load and detox, because you're not in that danger zone anymore, and the mitochondria can get unstuck from the cell danger response once that's happened.
right. And I find that with the brain support as well. So using the peptide nootropics have just been a game changer as well. But to use them after, I've noticed that they don't work so much when we're in that treatment phase that I was talking about. So I like to use C-Lank. C-Lank is an anxiolytic, but it also brings down inflammation in the brain, and C-Max, which helps increase BDNF and also helps to bring inflammation down in the brain, and dihexa. That's another peptide for when we're looking to get into more creative brain processes. So again, to be used more towards the end of treatment, so that I'm using the nootropics and mitochondrial support towards the end as well.
Mhm. Great. So, we've been talking, you were talking earlier about detox, but what about pre-tox? I guess this is one of the things you're also doing. You want to talk a little bit about how they differ and what you're doing exactly for these patients?
Yeah, so I have been, I thought I coined the term pre-tox until I talked to Chris Shade a few months ago, and he said actually there was another naturopathic doctor who used that term, and she used it in terms of preparing people for detox, right? Before doing cellular detox to remove toxins more generally. But
Mhm.
I've been thinking about it a lot in a different way, in a way where it relates to chronic illness. And it's really about setting the stage for people to be ready for detox. So, as you know, and I'm explaining to our patients, our population listening, that the toxins have to, before we do a cellular detox using certain substances like medications, IV medications to pull out metals from cells, IV EDTA or DMPS, for example, or before using phosphatidylcholine IVs or glutathione to pull toxins out of the fat cells. I want to make sure that the organs of elimination are ready for this. So a lot of our patients have genitourinary issues, or their liver enzymes are high, or they have gut issues. So I'm working on the terrain of their body, making sure that the organs of elimination are prepared and ready for this flow of toxins that are going to come through. And that's really what I mean when I talk about pre-tox in the context of people who are sick. So I'm preparing them for environmental toxin treatment, which I'm actually pretty heavy on. Uh, yeah, so that's, and then, also working on their hormones, all the stuff we talked about, like working on what's downstream first.
Great.
Yeah.
No, I think it's important. Now, earlier on, when you were talking about your method of treating patients, you mentioned something about using the right brain intuitive side apart to gathering, right, all the information from the left brain. Most people know I've been a Buddhist practitioner for over 40 years, and I've studied meditation with Tibetans from the Kagyu lineage. And I think, truthfully, the right brain intuitive is a very important aspect when you're dealing with chronically ill people, because as you're gathering this information, you can find literally 16 things that are wrong, but you have to kind of have a hierarchy of figuring out what is the most likely cause, right? Where do you have to start, right? So I think there is a part of gathering the information, but then understanding almost at an intuitive gut level. One of the teachers that I had, she's a psychiatrist who actually is an intuitive, Dr. Schultz. She used to use the term gut it. Like, did you get it? Did you got it? You got it? So to use the gut. So it sounds like you're also using, is it something you naturally came in with, or something you actually developed over time to help your patients?
Both. So the first thing I want to tell you is, when I had that lunch with you at iLads and I looked in your eyes, I could see your own clairvoyance. I could see who you are. Right? I could see your intuition, and it was so beautiful. And I knew, right? I didn't even have to ask you. I knew that you use your intuition. I was lucky to see that. And so I came in myself, a very intuitive person, and my family has a Sufi background. And so my dad actually taught me a lot about energy and about reading it, feeling it, sensing it. And then over the past almost decade, I've been working with indigenous healers. I have a couple teachers. And I also go to the Amazon, to the jungle, to work with the wisdom keepers. And Eric comes with me. Actually, we have the same teachers, and working in their ways, really working on ourselves, cleansing ourselves, right, as much as we can, because life always brings stress. And I don't want to accumulate it, because I know if I'm accumulating that in my being, if I'm walking with unresolved karmic patterns, how can I be there the best for my patients? So we're always meditating and working to clear our own internal path. And as we do that, our comprehensions open, and I'm always praying for my comprehensions to grow, my comprehensions in the grand mystery of our existence. But also, with each patient, I want to be able to see them through the eyes of what is real, not through my own film. Right. So
no, that's beautiful. You were very lucky, by the way, to have someone in your family teach you this a beautiful spiritual realm. Of course, being Horowitz, obviously, I came in Jewish with it, but I was studying Hinduism and Buddhism early on. In fact, I also studied with shamanic healers. I went down to Mexico and studied with the Huichol shamans. I've got Huichol yarn paintings all over my house. You're actually seeing two of them in the background here, by the way, that you're seeing on both sides of the medicine Buddha. Those are actually from the Huichols. But you're right. I mean, I think learning from these wisdom traditions and natural healers, it's not something, it obviously is a naturopath. This is something you might have had more of a tendency, but I always realized, even as a board certified internist, there was a lot of wisdom traditions way before we came around doing classical medicine. And I was always interested to find out, how they worked, how they got their tribes better. And always found it, really, really interesting. And I did read up, by the way, on the Sufis years ago, and it's all of the traditions. I think all of these traditions, they have a wisdom component that is just wonderful. I actually wish more people would learn about all the different ones to understand how they all kind of like they all have their specific flavor to it, but there's underlying principles, right, that are always the same as far as love and compassion and caring and yeah, and especially with healing regarding this aspect of it, the notion of your intention towards other people. I don't think people realize that sometimes the success we may have is because you actually really care about
Yeah,
people. You really
yeah,
want to get them better. You care about the person. They feel it. They know that you care. So it's not just all the herbs and the peptides and the drugs and the things we're doing. I think it's also us and the fact that we care and people know they're supported in the process. And that's a little bit subtle, right? That's not an easy thing to be able to always quantify, as far as sometimes why we may have better results, and it's always difficult to know, but I've always found it fascinating. Yeah, thank you for sharing that.
thank
That's great.
you. Yeah,
Yeah.
everything you just said, I think it's the glue that holds all of the biochemical processes together that we're trying to manipulate in the patient. It's
Mhm.
that love, it's that compassion, it's our own clarity. And like you said, just caring for that patient. Our patients know that we're coming with love to them. They know.
Yeah.
And I think it heals.
Yeah, and the healing process you were describing just earlier, that a lot of these people, I affectionately refer to them as the walking wounded. I had my own trauma when I was a kid with emotional and physical trauma. I understand trauma. And I would probably say somewhere between a third, 40% of people come in, mostly women, but sometimes men. There's big trauma. And I've learned over years, you could have all the infections you want, but if the trauma is affecting your immune system in a way that you don't feel you deserve to get better, because it's kind of like the mea culpa, there's something wrong with me, I don't deserve to get better. It's almost like the immune system gets wired in a way that it interferes with your own healing process. And I've seen people do very deep healing, some under a hypnosis, some in other ways. Right now, we probably use the anti-hopper dynamic neural retraining or gupta amygdala insula retraining as ones that I suggest to people. But I think doing that, physical, mental, emotional, spiritual aspect for the training, I think that form of healing is very necessary. And a lot of people, you're right, I think that emotional part of the healing is something we overlook, especially since the COVID pandemic has caused such havoc in families in the United States who've lost loved ones and everything else. I mean, so much of the country is dealing with depression or anxiety. You can't ignore it. You have to include that in, how are you going to get this person healed? It's not just healing the physical. I think the emotional, the spiritual, the rest, I think it's important. It's something we probably miss a lot.
Yeah, it's something we do a lot with our patients. I take it really seriously. And what you said about the traumas affecting the immune system. There's research on it, so there's scientific data on it, but we see it, we feel it. It's very heartfelt. We know, and like you said, the whole population is dealing with this. So not only are we having dormant bugs wake up, but we're having depression and trauma wake up as well. And a lot of times I can't even treat the bugs until we work on the nervous system and work on the immune system. Sorry, the emotional piece. Then the immune system starts to regulate a little bit on its own. Then we can come in
Where I
day to
think
day.
it gets very tricky, because I do see a lot of people who have been wounded, where it's, I think the trickiest is that Borrelia, Babesia, and Bartonella all increase the emotional reactions, right? So what you're dealing with is you've got this underlying trauma, the bugs come along, they're heightening, right? The worse. Bartonella is causing OCD, the Bartonella is causing psychosis. It's very, very tricky, because you've got to heal the underlying, and of course getting everything else in balance. And it's a tightrope walk for some of these people as far as where to start. And in some, I do notice, in fact, I just wrote up several case studies we submitted to the literature. And one of the case studies, I'll hopefully be published in the next month. This woman had trauma. She also had COVID 6 or 7 times during her illness and never got long COVID. But the amount of healing that this woman did to heal her trauma at the same time, of getting the COVID boosters and getting the injections and taking Paxlovid and doing everything we did and treating the infections and treating the adrenals and doing all of this, it was ultimately what got her across the finish line. She's now 1 year in full remission without any symptoms whatsoever after 6, bouts of COVID. And it's like, boy, but we had to work on every aspect of everything you and I have been talking about today.
Right.
And especially the emotional trauma, which was really playing a huge role. So I'm glad we brought this up because I don't think we've talked about it enough during the summit. And I think it's something that really needs to be highlighted because it does interfere with people's healing.
Absolutely. So thank you for bringing it up with me. I
Yeah,
appreciate
of course.
that. It's so overlooked and so important.
Yeah.
Yeah.
So you guys have recently merged Pacific Frontier with Gordon Medical, right, to now do Lyme and environmentally acquired illness. What is happening with this merge? What do you think? How do you think you're bringing the best of both worlds together? Because obviously Steve Harris is one of my favorite people in the world. So I mean, I love Steve and I've known him for a very, very long time as far as Nick and right the whole family. So how is the merger happening? What are you guys doing together?
Right. Well, first of all, we were talking about you last night. Your ears might have been burning a little bit, saying all the wonderful things about you. They're hard to say, right? And you know, Steve was trained by you. He was trained by the best, right? So, and he's one of the guiding lights in the Lyme world, and so is Eric. So we've got these OGs, right, of Lyme at the clinic, and then we've got us, the younger doctors, but we've been doing this for a minimum of a decade, 10, 16 years, each of us. So there's me, and there's Dr. Sugden, Dr. Kunkel, and Yvonne Sorensen, who's Steve calls her the best PA in the industry. So
Yvonne's amazing. I mean, she's absolutely amazing. I've known Yvonne also before she had kids, after she had kids. I mean, she's a fabulous human being.
that's wonderful. So I feel like we now have this think tank. So of course we're dear friends with Steve, and we've shared patients over the years, and we've had many conversations, but now under one roof, this think tank, it blows my mind, right? Because it means there's so much more that we can offer patients. I would even say that with this combination of doctors under one roof, I would call us the premier Lyme clinic on the West Coast, right? With this. And so it's just super exciting to have the OGs and then the people with younger blood who've been doing this for a long time and have had the mentorships from the right doctors to bring it all together to people who need us.
Yeah, when you say OGs, you don't mean the old guys, right? That's not what you're talking about.
No. I'm talking about the people whose shoulders we stand upon.
Yeah, that joke is for you, Steve, in case you listen to this. No, that's great. So, I'm sure people are going to want to reach out to you and get more information about you and your clinic. What is the best email address to contact you and Gordon Medical to get in touch with you?
Yeah. So so the website is gordonmedical.com, and my website is Nafysa. My email is nafysa@gordonmedical.com. And so then my staff is going to check that email and
Do me a favor and spell that for people just so that they get the right spelling.
yeah, it's N like November, A, F like February, Y, S like September, A.
Great. No, that's wonderful. And I agree with you. I mean, I think putting together the best of both worlds, because you guys were coming from a very strong integrative naturopathic approach. Steve has also been doing, of course, that for a very long time with his approaches. I know his approach as well, but also, of course, using other techniques. And as I said, when I spoke to Eric at ILADS, and I met you there too, please reach out. I'm having great success with the Dapsone protocol. And I think you'll find that in some of these patients, after you've gotten their immune system ready and you've got their detox, their pre-tox and their detox and everything kind of in line, you may find that some of these persistent biofilm protocols pulse, because at this point, I've gotten my protocols to 9 weeks of an oral generic protocol, take a break for roughly 6 to 8 weeks to let the counts return from Dapsone. And then if Bartonella is present, 2-week pulses of antibiotics over, roughly 8 months, 10 months or a year. And a lot of these people are going into long-term remission. The ones that I'm having the most difficult times with are usually I've got to go after the Babesia. It's extremely resistant. Or the mold, they're still in a moldy environment. So I'm pulling out the mold toxins, but they've got no place else to go. The mold has definitely, by the way, I have a lot more respect for mold over the years. Neil Nathan and I used to joke about this, that in my world, it was always infections number one, toxins number two, and it still applies. But all of a sudden, I'd say in the last year or two, I have definitely seen patients that the reason they did not respond the way I wanted them to was the mold toxins were there and they weren't even aware they were ever exposed. So I've learned my lesson, as any good clinician does, doing this in the trenches for so long, that I now screen everyone for it. Even if someone tells me, Doc, I've never been exposed to mold, it's like, you need to be checked because it's literally 80 to 90% of
Right.
everyone now I'm checking are exposed to these toxins.
Right.
So yeah, these are good lessons you'll learn over time.
Yeah, the mycotoxins, but I'm also screening everybody for the environmental toxins. In addition, I'm using the IGL lab from Germany, and we can really find just so much. It's amazing to see how toxic people are right now. And then I marry it with their genetics, right? So I'm doing the Intellex DNA test. I'm looking at many different systems of their body and their genes. I'm finding a lot of SNPs in their genes of detoxification, in their inflammatory pathways, in their hormonal pathways. I marry that with their toxin load, and it's really amazing with the way
So question, one of the things, and it's always a question with like Intellex DNA or any of these genomics ones that are out there. Do you find that the information you get, and I know Bob does a much better job than many companies out there, because when you look at his pyramid, it was something like 240,000 genes or something he was checking. But do you find that the genetic factors that you're finding, you can actually go over from like the phenotypic expression, like looking at those genetics, what's happening, and then biochemically adjusting it? Do you find like, is some of it theoretical or some of it you're finding really practical that made a difference that you might not have otherwise known?
I think it's a little bit of both. When if I'm not moving the needle on a patient by 3 months, I want to order that test because I want to see if there's something, I want to see what I'm missing, right? Where should I go next? A lot of the times it is, I've done that test enough, right? That I can suspect that it is about the inflammatory pathways. It is about the detox pathways. I feel like it's confirming what I already know now at this point.
Yeah.
But the patients love to see that data, though.
Yeah.
It helps validate them, right? A lot of times patients are told they're making this up or they're crazy, and then they start to think they're crazy or they're making it up or this isn't real. When they have that genetic data in front of them, they can show it to their family and loved ones and be like, no, this is real. Look at this, right?
Yeah, no, there's no doubt. I mean, and in fact, the doctors that usually tell patients it's all in your head. The joke I used to use with patients is, well, they were right. It is in your head. You've got spirochetes in your head. You've got neurotoxins in your head. But of course, these doctors were not trained in functional integrative medicine. They didn't know the right testing for tick-borne, right? They didn't know to look for mold toxins and metals and glyphosates and these type of things. Classical internal medicine is great. I mean, it's a wonderful field, and I've learned a lot, obviously, with all the training. But without the integrative portion, in this day and age with chronic disease medicine, it's very difficult to deal with these chronically ill patients unless you've had a good functional medicine or naturopathic background, right? I had to kind of teach myself the naturopathic ways over time, although, my medical training in Belgium probably gave me a little bit more of that because it was a 7-year program, not a 4-year program. And it was like 2 years of functional biochemistry. It's like, I beg your pardon? It's like, wow, 2 years of anatomy. It's like a year of ENT, a year of dermatology. It's like these guys really pushed it in all levels. So, but I think you have a distinct advantage for the naturopaths because you're kind of given with the terrain. That notion of terrain is a classic naturopathic way of looking at things. And I don't think it's stressed enough, right, in the way we normally look at things. And it's clearly important with chronic disease medicine. So, yeah, so that's great. Listen, I've really enjoyed talking to you today. This has been a great conversation. Anything else you think we missed or we didn't cover with this before we wrap up?
I feel like we covered it. I covered everything I want to say. So thank you for having me.
Oh, no, it's my pleasure. So those of you again who've been tuning in, my name is Dr. Richard Horowitz, co-host of the Healing from Lyme Summit. I've been with Dr. Nafysa Parpia from Gordon Medical. They just merged with Steve Harris and Pacific Frontier, and I think you're going to find, for those of you sick on the West Coast, you're going to find it's a great resource for those of you who've been ill who could not get better. So again, just one more time to get in touch with Gordon Medical and you, just so people can write this down.
Yeah, so you want to go to our website. If you're interested in becoming a new patient, there's actually right on the home page, there's a button for you to click on, and it'll put you in touch with our new patient coordinator. And that's the best way to get in touch with us, actually. GordonMedical.com.
GordonMedical.com. Okay, great. Listen, congratulations. You've got a great team of people there. Congratulations. And I would suggest also just a little to try and publish some of this work that you're doing, because I think you guys are doing very, very important work. And I don't think there's enough on some of the integrative naturopathic solutions that you're looking at. I think the medical literature could use it. So I would just suggest, as you're doing this going forward, take a look and see as you gather the data, because that's one thing I've been trying to do over all these years, is not just talk about it, but make sure I keep throwing this in the literature for other people to grow from my experience, right? Just like I've grown from Dr. Boroscano's experience and Sam Donta and Ken Liegner, right? All the giants on whose shoulders I've stood on, right? I mean, we're all learning from each other, right? As the years go on. So real pleasure speaking to you. You're very bright. You're clearly motivated. I love the approach that you're doing. It was a great talk today. I know people are going to enjoy it. So please say hello to Steve and Eric and the whole group. And I look forward to hearing great things from the clinic.
Thank you so much.
Okay, my pleasure. Goodbye, everyone. We'll hope to see you again on an episode soon for the Healing from Lyme Summit. Bye-bye.